Health Education Lecture Series. All the listeners of Health Education Lecture Series, I am your host, Gurdeep Singh Sandhu, homeopathic consultant. And we are passing through the area of chest because of some questions was arising time to time, and I was supposed to answer those questions before I advance in my lecture. In this way, two lectures were of different style, though they were related to the medical science, they were related to us, they were related to our life, but even then that were of different nature. Whereas in a routine, in a systematic series of lectures, I'm describing this system, this body, uh, uh, as per it has its organs in different areas of the body and their functioning and the diseases of the body and diseases of those organs. So, after describing the chest area, I told you about the organs which are situated in the chest area, and about the lungs. I have given you the details of that one, and also the diseases concerning with the important diseases concerning with the lungs at that time. And also, after that, we were describing about the mediastinum, and I have described about the mediastinum, just like uh, the major important organ in the mediastinum is the heart, and most of its portion is situated in the left side of the chest, whereas some of the portions, only 1.2 centimeter, it's also having its boundary from the mid-sternal line to the right side of the chest. So this is what I have already described, and many things about the heart valves, heart muscles, arterioventricular septum, or the valve, you can say that one, and bicuspid valves, tricuspid valves, semilunar valves. All these things I have described about the heart. But even then, if anyone else wants to get more knowledge about that one, and or is having some confusions from these lectures and wants to get some more information about that one, he can call me directly at 408-687-1899, or he can email me to get his answer about that one, and I will give him his answer in the emails as well. So, describing the mediastinum, with which we have described the heart, and there were some other organs just like the bronchial tubes, trachea. I have described about the tracheas, and bronchial tree. I have described about the bronchial tree, lung substances, pleura, and also in the heart, pericardium membrane as well. And the difference or the relation between all the lobes, I have described that they are separated by the visceral pleura, and they do not have direct relation with each other, but their relation is directly with the bronchial tubes, with the blood vessels, which are passing and entering into the lung substance. So this is what I described about the lungs. And after that, when we were describing the mediastinum in the beginning, and I describe it that the mediastinum is an area of about 8 inches wide, and towards the back side, it is up to the vertebral column, from sternum to the vertebral column. It may be of different variations of the length backward side, because every person has its individual chest size area, so that's why it may be a little bit difference. So the wide 8 inches wide area, from 6 to 8 inches, you can imagine that in centimeters there is some difference about that one. So in this way, After describing this mediastinum, I told you that we can, for the easy explanation, for the easy understanding of this area, we have described this area divided into three different names. The anterior portion of the mediastinum is known as anterior mediastinum. The middle area is known as the middle mediastinum, and the posterior, the backward portion, is known as the posterior mediastinum. But one thing more I told you about this one, that if you will cut, just like our neck is cutting a portion, head is separate from the trunk. Trunk is the whole body from chest and abdomen. These both composes the trunk of our body, and the head is a separate thing and attached with the neck to this trunk. In this way, the mediastinum, as I told you, the mediastinum, we have given the three different portions of the mediastinum. But if from all the portions, if we cut the upper portion of the mediastinum, just like the neck is separating the head, that is known as the, just one word you have to add with that one, the superior anterior mediastinum, superior middle mediastinum, superior posterior mediastinum. So in this way you can divide, because it has a different organs. We have already described that these are the organs in this area, and I have given you the description, just like the and this uh, trachea, bronchial tube, main bronchus and the right and left bronchus, thymus gland, esophagus, which starts from here and goes to the backside. And in this way, I have given you the description of the organs which are situated in this area. So after that, we have described one by one the superior mediastinum from its interior portions. From its interior portion, the main thing was to discuss was the thyroid gland, and I have given you the description of the thyroid gland. Here, I explained many times that I'm not giving the detail of everything. No, I'm just making you aware that in this area, these are the organs, and these are the main function of these organs, and these are the main important diseases of this area. So, for the easy understanding, that everybody can understand, that if somebody says thyroidinum, if they understand hyperthyroidism or hyperthyroidism, so you can well imagine that this thyroidism is connected to the neck, or you can say the superior anterior mediastinum. So in this way, you can figure it out that this disease is concerned with this area of the body. So in this way, hyperthyroidism and hypothyroidism, both I have discussed with you. Hyper is with the excessive, accelerated activities of the body. Every function of the body is accelerated more, and in hypo, the every function was slowdowns. So in this way, what were the effects of the activation of more activation of the functioning of the body, and what is the effect of the less functioning of the body? In this way, just like the obesity, this is the differentiating points. Obesity is a differentiating points. Many of the things you cannot see, but many of the things outwardly you can see that if a person is eating well, even then losing weight, slimming, and that's the hyperactivity. If a person is eating less, even then he is gaining weight. It's a hypothyroidism. And some other activities like the protrusion of the eyes, pressure in the eyes, redness in the eyes, all these things we have described every time when we are discussing this chapter of the chest, so that everyone should be aware of this one, that these are the signs of the thyroid gland, whether it is hyper or whether it is hypo. Losing weight in hyper, and brittling of hairs in hypo, and losing of hairs, falling of hairs in the hyper. So in this way, many of the things we have discussed, tingling and all these things, skin dryness or excessive sweating, These are the differentiating points. In hyper, there is excessive sweating. In hypo, there is a dryness of the skin. So you can well imagine, even a layman, if he listens these lectures, he can understand that the person who is having a complaint of thyroid will be having these kind of symptoms, and will be having this kind of symptoms, that these are indicating the hypo or the hyperactivity of the thyroid glands. So in this way, after that, we reach to the conclusion of the next chapter, that was the aneurysm. So aneurysm is a ballooning of the blood vessels. Ballooning of the blood vessels. Blood vessels are made of three main layers: internal layers, the middle muscular elastic layers, and the third one, the connective tissue outward layers, which unites, which bind, you can say, which binds the blood vessels, which fixes the blood vessels with the outwardly walls or outwardly organs they are attached to. In this way, the blood vessels remains in a fixed position. So that is why these are the three layers of this one. And if in a case the blood vessels becomes weak from any point, for any site, reason, whatever may be the reasons, I will tell you, whatever may be the reasons. But if any point, at any site of any blood vessels, it is weakened, the blood vessel walls are weakened, and with the thresh, with the pressure of the circulating blood, it dilates outwardly, it bulges outwardly. That's known as ballooning, a type of ballooning to dilate a limited portion of that one. That is called aneurysm. And this aneurysm, mostly, mostly aneurysms are considered aortic aneurysm in the chest, and also the abdominal and this aneurysm. But it's not that only we have only problems of the blood vessels in the chest area, and that is the aneurysm. No, we can have aneurysm even in the brain, and it all depends upon the weakening of the blood vessels. Wherever there are a weakness of the blood vessels, they can balloon if there be any excess of pressure in the blood vessels. The blood is flowing through the blood vessels, and if there is excess pressure and the blood vessels are weak, they balloons out. And that ballooning out is a dangerous, because we can expect in future that it may rupture. If a site of the blood vessel is weakened, and then ultimately this threshold, the pressure of the blood vessel has ballooned it out, it means ultimately it will become more and more weak. It will become more and more weak, and ultimately it may rupture at any distance. And when it is rupture, it may produce a serious condition, immediate concern, or even sometimes you can say the immediate death. Depends upon the area, and depends upon the blood vessel. What blood vessel has been damaged in this way? And for that one, I told you about this one. The thoracic aortic aneurysm is the serious condition. Regarding that one, I describe you the aorta, basically the main blood vessels in our body, which starts from the left ventricle of the heart, just 3.5 inches from the left nipple. If you go down into the ribs, 3.5 inches down into the fourth and fifth ribs, between the fourth and fifth rib. This is the area, especially of the ventricle of the heart. That is the left ventricle of the heart, from where this aorta is issued. And then aorta ascends upward. It goes upward because it is the bottom of the heart. And then this blood vessel goes upward. And when it goes upward, then it goes to the area where there is thymus gland, and at that time, after passing the thymus gland, it is curved, and it is curved towards the backward, and that curve is known as arch of aorta. And that arch of aorta has two other distributaries releasing from here. Those are known as the carotid arteries, which are supplying the blood to the head. And after that, this aorta is turned towards backside, towards the vertebral column, and goes downward alongside the vertebral column to be, you can say, to supply the other areas of the body, just like the thorax and the abdomen, and after that to the both legs. In this way, these tributaries, because first of all, the big pressure is at the first area when blood is releasing from the heart, and the first area may be damaged anytime. And these aneurysms are produced at the ascending aorta, at the first portion of the aorta, that is the ascending aorta. And most of the aneurysms are produced at this area because there is a big pressure. After that, it can appear at any times. Sometimes there may be blockage forward by somehow there is a swelling, there is a tumors, whatever may be the reasons. There are many more reasons behind that one. But if furthermore the circulation is going in the arteries and there is any blockage, outward blockage or inside blockage, that will cause a backward pressure, and pressure may balloon the blood vessels, and it is serious. Basically, it's very rare in the arteries, but it is in the artery only. It is in the artery mainly. And but if happens this thing, if the causative factors are not removed and not understood, and we cannot remove those one, sometimes it may be serious. How big ballooning it may take, and ultimately it has to bust it out. So therefore, if there be any ballooning or any kind of, you can say, the aneurysms in the aortic area, it's always a serious thing, and we should find it out the reasons behind that one, and we have to find out the vascular study that where suppose. We know that the purpose of the artery is to supply oxygen and food to the whole body at a distal area, at the distal portion of the body. And wherever you see the blood circulation is slow, blood circulation is not going normal, a particular area having a sign of deficiency of circulation, nails, any one arm, any one leg, or any one area, which is not being supplied normally and it is not having normal signs that it is getting circulation of blood, we must think about in the backward area, somewhere there is a blockage. And we should find it out and should remove it out if possible. Otherwise, ultimately, anytime there may be ballooning of the main blood vessels, and it may be serious at any time. Therefore, we consider the aortic aneurysm is a serious thing because it's a main blood vessels which has to supply the whole body, head as well as the under trunk and the arms and extremities. It has to supply that one. So there, the main force is there. So sometimes because it's not only that there is any pressure on the blood vessels or any, there are certain diseases of the blood vessels which can produce weakness of the blood vessels, which cannot hold the pressure of the blood vessels and blood flowing inside that one, and they can balloon also. So we have to find out the reasons behind that one so that we can take care before it happens. Before it happens, one thing I can tell you, just like I told you about this thoracic abdominal thoracic aneurysm, and also the abdominal aneurysms, and the routinely what we see, maybe because of the bad effects of the medications you are taking, maybe because that you are addicted to drug type of things, maybe you are addicted to tobacco type of things, and it also weakens the blood vessels. It weakens the blood vessels, not only the blood vessels, but it weakens as a whole system, because the oxidation process is slow down. And when there is a oxidation slow down, ultimately everything becomes weak. If you are not getting oxygen, even when you go to the hills, you do not get the oxygen properly, and you are having a breathlessness. You cannot walk fast. You cannot walk fast means you are tired and you want to sit down, because the oxygen supply is not properly given to all the tissues. In this way, if any reasons comes in any person, that may produce weakness of the blood vessels on that area where there is a no supply, and ultimately weakness of the blood vessels may produce aneurysm. And not only the aneurysm, sometimes this may burst out. And the smallest indications for this one, you can see that many of the people who are putting on regular medications, putting on steroids, or just like I told you about the tobacco or any drug addicts peoples, they are regular, and ultimately what happens? Bad effects of all these things ultimately results in the oxygen carrying capacity is lower down. And when the oxygen capacity is lower down, it means oxygen is not properly supplied to the tissues, to the cells. They are weak. The same thing happens with the blood vessels. It does not mean that blood is flowing. Just understand one thing. It does not mean that heart is supplying the blood to the whole body and he can take whatever quantity he wants to. No, not at all. He is having a blood with full oxygen. Does not mean that he can take the full oxygen blood first of all himself, and then he will supply the remaining portion of the blood. It's not like that, because many times I describe you about this one, that the heart is getting its desired circulations, means desired oxygen and the foodstuffs, according to the criteria fixed for everybody. And the criteria fixed for everybody is that every organ has its own circulation, the arteries and the veins. And the same way, the heart has also its own circulation procedure that's known as the coronary artery. And it's supplied by the coronary artery. It's not that he can swallow whatever amount he wants to. The muscles cannot swallow like that one. They are supplied by the similar type of channels set up for the heart, that is the coronary artery. In the same way, I'm talking about the circumference, the other areas of the body. And sometimes, because this weakness is because of some reasons, whatever may be the reasons, just I told you, there may be drug addict, there may be tobacco smoking normally, or there may be some diseases of the blood vessels, or there may be any regular medicine he is taking, and that makes you weak ultimately, just like the steroids and all those things. If you are taking a long time, so ultimately they weakens your whole body systems. And whole body system means veins and arteries are also in it. And when the arteries are weakened, but arteries are getting regular pressure, none other organ is having that much dealing with the pressure as the blood vessels, and especially the arteries are. Means everywhere stuff is going, stuff is coming out, but they are not forcefully pressurized. Just like the portal system is getting intestinal blood back to the liver, it has, but it's not having that much pressure. As the pressure is inside the arteries, which are releasing from the aorta onward and into the circumference in the distal areas. And in this way, always pressure bearing blood vessels or always pressure bearing organs are the arteries. And if they become weak, if they are not getting their proper food, if they are not getting their proper oxygen, ultimately they will be weakened, though it's a portion of that one. The whole body cells are not getting proper food and proper weakness, and a person is generally weak. Generally weak does not mean that arteries are not weak. No, the same proportion, the arteries are weak, and ultimately there are chances to be produced aneurysms. And there are ultimate chances are, if the causative factors are not removed, there are chances that aneurysm may rupture. The smallest indication for this one, I can tell you might have seen people are taking regular medications, many more medications, and they have done some blue spots on their skins, here and there, on the arms and sometimes on the legs and all that. You see those things. What is this one? This is the peripheral arteries. Peripheral arteries are broken down. Definitely before broken, they may be having ballooning, they may be having swelling, they may be having some irritation inside the skin. You scratch it. Ultimately, the blood vessels inside the skins, they ruptured. First of all, they balloon out, then they ruptured. And what happens? Remaining portion of the oxygen is sucked by the adjoining tissues, and the remaining portion of the solid material of the blood remains over there, just like outside. If the blood is drained outside, oozing outside, you see it's red. And after some time, it becomes brown. Then it becomes black sometimes. Because as the oxygen is squeezed out of it, it becomes black. In this way, when you see spots on any of the persons, on the arms or on the legs or anywhere, this is an indication that the small blood vessels are weakened. Whatever may be the reason that just I told you about, all these things are weakened, and they are unable to bear the circulatory pressure. They are unable to bear because the pressure is slow down. Even it goes to the distance, it is slow down. It's not that much as it is in the aorta, as it is in the chest. There is a big pressure. But as it goes to the distance areas, just like the fingers, hands, feet, all that, it is slow down. But if you see this kind of signs that there are blue, brown spots or black spots on side the skin, it indicates that the arteries, the peripheral arteries are not able to bear the pressure of the circulation. They are ruptured. And before rupturing, they might have ballooned to the maximum extent. Ultimately, they ruptured. Blood oozes outside into the tissue spaces because skin is over that one. And ultimately, the oxygen or the food stuff, whatever there is, it will be sucked out by the adjoining cells, and there will remain only the solid remaining residual portion of the blood, which will give a stain to your skin like this one. First of all, it's a brown color and a red color, then it is brown color, and after that it becomes black. And it's the normal understanding that you can understand why these are spots. So whenever a person is having this kind of indication on your arms, on your legs, anywhere you can say, it indicates that the blood vessels are weakened and they are having ballooning type of conditions, and ultimately they have ballooned, burst out. So I'm saying this is an indication for you that not only in the peripheral arteries it has happened, it may happen into another big blood vessels that may become weak. If the peripheral arteries are weak, it may happen to the main blood vessels, and under those conditions, it may be more serious. This is an indication. So, whenever you see this kind of things in any of the persons, please be aware that it's not a simple thing. The God nature is giving you an indications that go check you up. Whatever are the reasons, try to remove those things. If it's addiction of the drugs, addiction of the medicines, addiction of anything, whatever you are taking, you have to do the survey of your body so that ultimately damage you can stop. Otherwise, the day will come when your heart, when your main blood vessels may rupture, and at that time it may produce the serious conditions. Next thing, blood pressure is the main reasons behind this one. If the rising blood pressure in the arterial pressure may cause ballooning of the blood vessels, that is the aneurysm, anywhere. So take care of this one. And the causes behind the blood pressure is the main cholesterol. Cholesterol, you have to take care of that one. These are the initial things when we ignore all these things. If the cholesterol is high, we ignore all these things. And ultimately, we know that the total cholesterol is 200 for as an average person, but it should be less than that. And those who are having this kind of ballooning type of things and all these things, they should have lower total cholesterol, lower than 200. That may be 170 or even 130, 40, depending upon the conditions. If not, ultimately it may result in a backward pressure in the blood vessels, and it may result into the aneurysm of any blood vessels. So therefore, cholesterol is the basic thing as far as the diseases are concerned, as far as the physiological factors are concerned. You have to take care of the blood vessels. The drug addict, tobacco, all these things we have already considered that one. So whatever you are extra than food you are taking, which is not necessity of the body, which is not required routinely for the body in a normal healthy life, you have to avoid those things. And the medications, just like medications, if you are taking, and try when you see these kind of signs, try to survey your medications, discuss with your doctor that these are the signs, these are the preliminary indications for you, and ultimately it may result in the damages in the major blood vessels and producing the aneurysm over there. And aneurysm is not only that when it will rupture, then it will produce signs. No, even the pressure symptoms of the adjoining organ may cause. Suppose if there is aneurysm in the aortic arch or in the ascending area, at that time the adjoining bronchus may feel difficulty to pass the oxygen in and to exclude the carbon dioxide from the lungs. So, what will happen? There will be a breathlessness. Ultimately, without cause, even a normal walking, if a person is having breathlessness and you see there is no cough, there is nothing like the serious thing which you can correlate with the lungs, and even then, if these type of signs are the breathlessness only when he goes upstairs, when he walk fast, and if he is having breathlessness, this is the indications for you that there is a backward pressure, and the blood vessels are not bearing that pressure. There may be any swelling. Initially, you can say it's swelling, but it is basically ballooning at one point, and that ballooning at one point is pressing out some of the adjoining organs, and the function of the some adjoining organ is disturbed, and you can see the signs and symptoms outwardly of that organs. Heart is palpating, you can understand that one. That's a normal thing, it's going on. But if you see breathlessness, dyspnea, normally there may be reasons, and also this kind of reasons which I told you about, that there are spots of internal bleeding inside the skin. So these are the initial indications, sign and symptoms of other adjoining organs of any blood vessels, may be the reasons of any aneurysm. And also, the peripheral spotting under the skin is also the initial indications for you to understand. And this can happen to major blood vessels as well, and that will be more serious. So, we have to follow the initial conditions of the body. And if any person is having this kind of conditions, we should be alert, and we should take care of all these things so that it should not advance and rupture and cause a serious outcome for this one. So rupture is the complications. Rupture is a big complication. And the tear, dissection, sometimes what happens, the blood vessel is not ruptured because there is nature has provided a muscular layer, and that is very hard, and after that there is a connective tissue layer which joins the blood vessels with the other organs. They are very hard, and what happens, the inner layer of the blood vessel is ruptured. Then ultimately it's very painful. With every beat, it is painful. With every beat, it is painful. And then you can well imagine what will be the condition of the persons. And this type of condition, even in the beginning, is serious because the internal something, if our finger is lacerated by anything, and you can well imagine how painful it is, because it is touching to our superficial nerves, and nerves are very sensitive, and we are feeling pain if anything is scratched on our body up to the bleeding level. The same way, if this happens inside the blood vessel, from the inner lumen of the blood vessels, the inner lumen has been ruptured with the pressure of the blood, and ultimately it can go deep and deep, deep and deep, and ultimately a big area, internal membrane may be ruptured, and that will cause a different type of situations. You should be aware of that one. Ultimately, internal bleeding internal bleeding is a serious thing. If it is in the major organs, definitely it is a serious thing. But sometimes the internal bleeding, the outward spotting, this is a simple thing we can understand and we can be alert of that one. But sometimes the internal bleeding in the abdomen is also a serious thing. Heaviness, because whenever there is internal bleeding, it puts pressure on the adjoining organs, just like the kidney, just like the spleen, just like the intestines, and all that, and they have their own symptoms with the clogging, or you can say with the aneurysm of the blood vessels. So in this way, internal bleeding signs, the low pulse, low blood pressures, circulation, and all these things. These are the signs and symptoms, showing respirations, because oxygen is not supplied to the distal areas, and the distal area will show the signs of you can starvation. Distal organs will show the signs of starvation, dryness, weakness, difficulty in moving the limbs. All these things can happen in this way. So it's a type of medical condition, and at that time, definitely, even in routine, you avoid all chemicals, Avoid all chemicals which can damage your blood vessel, which can damage your all other tissues. And if they can damage your, just like a person is smoking, definitely we assume that his lung substances will be damaged. Not only the lung substances, because this tobacco is affecting the whole system, the whole body, and ultimately the blood vessel will be slowed down, will also be weakened, damaged, and ultimately it may result in ballooning. Anything which produces hypertension, just like I told you about the cholesterol, anything which results in hypertension, even maybe sudden, maybe psychic cause, that can cause this type of conditions, because the pressure, backward pressure, is increased in the arterial, which is not possible normally. The backward pressure in the arterial is normally not possible. It is only possible if there is a big pressure on the route of the blood vessels. Then there is a backward pressure, and then at that time there may be a ballooning, and ballooning may result in ruptures. So all these things systematically, and blood pressure should be taken care of, cholesterol should be taken care of, drug addiction should be taken care of, healthy exercise and normal fatty diets or fatty plaques. Avoid all these things so that you can save yourself. The other thing for the elderly peoples, other thing for the elderly peoples, with the aging of the blood vessels, with the aging of the tissues, the blood vessels show a sign of atherosclerosis. Blood vessels, the elastic, in other words, you can say the elasticity of the blood vessel is damaged, is not to the normal extent which it was at the young age, which it was in the young age. That elasticity does not remain at that level. And if elasticity is lost, but the pressure is coming up backward, now the heart has to, because just like the liver system, blood is pushed from the heart, and a type of liver system, contraction and relaxation of the blood vessels, it is pushed to the distal areas. But suppose if that elasticity is lost, means that liver system is damaged. And liver system is damaged in this way to send the blood up to the finger level of the tip of the fingers of the feet and all that. Heart has to work hard. Heart has to work more. And under those conditions, what will happen? It will produce a palpitation. It will produce increase the number of thrush, means that is the, just like you said, in a normal we are having 72 to 80 per minute palpitations, but it will increase. And even then the heart has to use the more force to sell the blood to ultimate of the body. Ultimate means the fingertips, up to the fingertips, finger, feet, and even the hands. It has to send that blood up to that levels. So then heart has to work hard and and he has to force the blood. In this way, the arteriosclerosis also a one reason for the increase of the blood vessels. And you have to maintain this thing. And especially, you should not add to this thing that the fatty food and all those things, when you are getting aged, all these fatty things are not uh, acquired or advised to you, because it may add any fatty deposits into your arteries, and it will form a plaque which may rupture with the pressure of the heart and may create a ballooning type of things. And not only the ballooning type of things, the blood vessels may rupture. So all these things we have to take care of the, especially after 60 or 65 years of age. After 60 or 65 years of age, to take care of the blood vessels, and to take care of the blood vessel means to take care of the arteriosclerosis, which is the main or the normal disease at this age of the blood vessels. So you have to save yourself to do all these things. In case the aneurysm is in the brain, as I told you, the two-third blood from the arch of aorta goes to the brain by two carotid arteries. And sometime, because of any problem in the organs, any problem in the meninges, any problem in the ventricles of the brain, sometimes there may be this kind of condition that is known as ballooning or the aneurysm in the brain. That aneurysm in the brain, though it's a very serious condition, but even then, before it ruptures or before it causes the serious condition, it sends you the indications. Ptosis means eyelids are dropping down and the person is unable to open the no other signs. Everything is going normally. You do not have any problem, and the patient does not say anything at this in the initial stages. But you see, he will say, "I cannot open the eye." It's not the allergic type of thing. Sometimes with the allergy, or sometimes with the only localized swelling of the eyelids, people are unable to open the eyes. And even some of the conditions are this type, the allergic type of condition of this type, that uh, people are unable to open the eyes. And even the drug, sometimes the medications, all these things produce this kind of condition that a patient wants to sleep or patient is unable to open the eye. In this way, that is known as ptosis. And but if this thing happens even without any known causative factor, these are the known causative factors, that if a person is having and taken any medications, or if as a person is not slept since long and now he's sleeping quite deep, and if you ask him at that time to open the, he will not be. But I am talking about the aneurysm, brain aneurysm. Under those conditions, the brain aneurysm, it puts the pressures backside and pushes the pressure on these, you can say, the nervous system, and ultimately the powerlessness in the eyelids comes up, and the upper lids are swelled up and also difficult to open the eyes. And also, side by side, there may be a swelling on the face, swelling of the forehead, swelling on the cheeks, and around the eyes as well. These are the signs of cerebral aneurysms, brain aneurysms, you can say that one. And that's also a serious condition. Stroke and all these things when happens, internal bleeding. Okay, all these are the secondary signs, you can say. The initial sign is difficult closing the eyes, unconsciousness when you wake up, when you move, because that aneurysm is putting pressure to the adjoining areas, and the adjoining areas produce dizziness when you rise up from sitting, when you walk. Under those conditions, you should be careful that this is what happening in this way, and that's a serious condition. If there is a brain hemorrhage, that's known as stroke. People talk about stroke. One thing here comes to my mind to explain you about the heart attack and a stroke. These are two different things. Stroke is when there is internal bleeding in the brain. And definitely, if there is a bleeding, it means that before that there was a ballooning, before that there was an aneurysm, and aneurysm has its own sign and symptoms in routine. If it's a sudden injury, that's a different thing. Sudden accident is a different thing. But in routine, if a person had an attack, he will be having a history that he is having this kind of blood pressure of that type of things, and any other thing, dizziness when he walks, when he rise up, and gait is tingling, he cannot walk straight, and the dropping of the eyelids. All these are the preliminary signs you can see that something is going to happen, and immediately you have to take care of that one. Okay, so this is what the sign and symptoms of the brain aneurysm. And the any problem in the coronary artery is indicative of the heart attack. When the circulation or the blood supply of the heart muscle is blocked, is stopped somewhere, that produces the heart attack. Okay, so as stroke, which is known as, mostly the reasons behind that one is the blood pressure, maybe any other reason as well, but its stroke is concerned with the brain when the blood vessels are ruptured and there is internal bleeding. And before rupturing, there are signs and symptoms: swelling of the face, swelling of the eyelids, and dropping of the eyelids, and dizziness. All these are the preliminary signs of the aneurysms. And if it ruptures, automatically it produces stroke, unconsciousness, sudden unconsciousness, and sometimes it produces paralysis. Whatever the nerve has been damaged, whatever the nerve has been pressurized by this internal bleeding, that nerve will not come, will not work normally, and ultimately the tributaries, distributaries, wherever it has to control, that organ will lost its power. So that is why for the stroke we say there is a powerlessness in the right arm or in the left arm or in the legs and all that one. That can happen in these kind of conditions. So you first thing, I will repeat all these things. The first thing is the ballooning of the artery is known as aneurysm. It may happen in the brain, it may happen in the chest, it may happen in the abdomen, or even in the peripheral arteries. Peripheral arteries ballooning and rupturing is the indication, preliminary indication for us that in future there may be a serious condition and the main blood vessels may be ruptured or ballooned out, which will produce a serious condition for you. So you should be careful of that one. The after that I told you about the causes. What are the causes about that one? So causes regarding the blood pressure, whatever may be the reasons behind the blood pressure, just like the cholesterol, or the causes behind the chemicals, any type of chemicals you are inhaling, or you are working in the industry in the chemicals, or you are taking some of the medications which has resulted into the peripheral rupturing of the blood vessels. You should be careful and you should avoid those medications at that times. And the cholesterol, I already told you about this one. So though conditions which can block the inner lumen of the blood vessels, you have to survey and avoid all those things if you want to survive for a longer, and you want to survive for as a healthy, then you have to take care of all these things. Okay, so cholesterol, blood pressure in any way, and then any smoking, any drug addictions, you have to avoid all those things so that there should not be a plaque formation inside the blood vessels, and should not produce an arteriosclerosis, which is the old age disease. Mostly the blood vessels of the old peoples are becoming hard like raw, and heart has to push more pressure to send the circulation there because the elasticity has been damaged, and ultimately with the more pressure, they may rupture, and ultimately these type of signs we are resulting. This type, last word, this type of condition also happens in the veins as well. And ballooning is not used, that the word over there. Aneurysm is not used, the word over there, but the varicose veins are used. Varicose veins are the same thing. The peripheral veins which are draining their blood back to the main veins, so that it should go back to the heart. Just like the important example is the anus. A bit important example, just like the Bawasir and piles, you say everybody, this is the backward pressure. It's also ballooning, okay, and rupturing. the bleeding piles and all that. This is also rupturing. This is also concerned with the veins. And the same way, the veining, the varicose veins are also the preliminary condition before it ruptures of the blood vessels. And these are backward pressures because the main artery or main vein, we were talking about the veins, main vein has been clogged up with the fat, with the this type of deposition inside the lumen, and that has been blocked up. And because of that one, there is a backward pressure in the tributaries, in the peripheral veins, and that are bulged out of the skin in bundles. That is known as the varicose veins. That's also a type of ballooning or a condition of the aneurysm. Basically, that's outwardly expressions, and sometimes it may be serious, but not that much serious as the arterial aneurysm is. Arterial aneurysm is more serious because this is the main drain, main supply line, whereas the veins are carrying the wastage, most of the wastage of the body with the backward going blood. So, in but there is a difference in this one. So that's why venous obliterations, venous ballooning or aneurysm is not that very serious. It is serious, but that very serious as compared to the arterial balloonings. So be aware of all these things, all the preliminary indications, so that nobody should have any brain hemorrhage, nobody should have any stroke or ballooning or this type of things, or any aneurysm in the aortic artery or aneurysm in the you can say the descending abdominal aorta as well. So today my time is over. I am your host Gurdeep Singh Sandhu. My phone number is 408 687 1899. My email address is Homeo Medicine, HOMEO at yahoo.com. Anytime, if you are suffering from any disease and you want to take a second opinion about your disease, or even if there is no progress of your treatments, please call me. I can give you the natural way out. That what are the hurdles in your cure? Why you are not progressing in your cure? Why the medicines are not responding? I can give you the clue about that one. And even if you want to get treated with a scientific approach of the homeopathic medicines for your disease, whatever may be the disease, no matter, because we in homeopathic system of treatments treat the patient as a whole personality, not the individual organs, not the individual disease name, because diagnoses are made after taking few important symptoms of the disease into considerations, not the wholesome history of the patients. Whereas the homeopathic deals with the whole personality from head to heel, and head means mind, mental symptoms, and head to heel means all the physical symptoms. So we consider there is no question that we are treating the diabetes. There is no question that we are treating the blood pressure or any by name disease. No, until and that will be temporary things. If we go, oh, these are the medicine concerned to the blood pressure, these are the medicine concerned to the sugar, we will fail. Even we are not doing more than allopathic style. They are doing more than us because they are controlling the things. Whereas question of cure is concerned, this is a separate thing. And cure is only concerned if you take the original thing from where it has started and you cure it from that point. And every disease starts from the mental sphere. So you have to take this mental faculties symptoms, and if you should treat according to that one, and then everything will be taken care of. So therefore, if you want to be treated your any disease, if you are suffering long and not getting well, to get the opinions of my 52 years of practice, you can call me at 408 687 1899. God bless you all. And perhaps tomorrow there will be a Punjabi lecture. and Radio Pravas will be joining with us at the same time, and that Punjabi lecture will be according to the procedures. As I told you, we are advancing in our lectures of the chest as well. Thank you.